With Claremore Service Unit, Mr. George Valerie.
Good afternoon.
Good afternoon.
Oh, I think I have a report in your packet, but let me hit on a couple of things. We just received our centering program for our OB patients just got reaccredited. We had a survey and review, and we got accredited there for another year. If you're not familiar with that, a centering program is a group. They come in and meet in a group several times a week, so new moms can kind of bond with old moms, and as a group, they get through the system, and we've had some really positive feedback on that, so that's really been a success for us. We have some remodeling projects that have been awarded. We're going to be doing some work over in the women's clinic, trying to add some more exam rooms over there. And surgery, same deal with surgery clinic. And then with surgery clinic, we're going to try to put we are going to put some doors out there at the end of the hallway so that the docs, where their exam rooms are, is a little more private for the patients. So patients can't just walk right down the hall and go out the door there. So, and then we're, the ER project, the emergency room remodel, I'm told has been sent down to Dallas for approval, so hopefully we can get rolling on that sometimes in 2017. We're almost done working on the language for the orthopedic contract there in town. If you're not familiar, our orthopedic patients we send to Oklahoma City. The area office has a area-wide contract with an orthopedic practice down there, and it works well, care is good, but the patients have to go all the way to Oklahoma City for that. So we've been in negotiations with Hillcrest there in town. Our attorneys what we need to do is set their attorneys down with our attorneys so they can get this language hashed out in one meeting instead of going back and forth. So hopefully here, by the end of the year, we'll be up and running on that contract. Table any of our patients that are eligible patients, just go up, sign up at registration, and go over and get your flu shot. You don't have to go see the doctor or anything. And then October 27th, the evening of October 27th, we have planned our annual fall festival. This came about. We started doing a cookout for all the employees from the administration, show appreciation, and then we could just kind of couple that with the Halloween celebration and labeled it our Fall Fest, and this is going to be our third annual. On the 27th, we'll start, we grill hot dogs, and goes over well. Kids, that allows the employees to go home, bring the kids up, let them dress up in their Halloween costumes and come up, and a lot of the different departments put up different booths out there on the front lawn. So if you're around, stop by, have a hot dog with us, and we don't bob for apples. We've already stopped that. So we have a lot of games there, and the kids have a good time. So if you have any questions.
Does anybody have any questions?
Yeah, I do.
Counselor Bezer?
George?
Yes, sir.
Claremore.
Yes, sir.
Yeah, and I've been watching your third-party collection, and I see they're up almost $5 million. What do you attribute that to?
Good visits and good coding. Our coders have been for at least a year. They've been doing both. And as we went over to ICD-10, I'm told that's really made a big difference.
And you may have the number of patients that you see there a year. What is that?
Historically, we've hovered right around 250,000.
Thank you.
You bet.
Any other questions for George? Looks like that's it.
Thank you.
Thank you. And Cherokee Nation Health Services, Mr. Brian Hale.
Good afternoon. I'll be representing Cherokee Nation Health Services for the Health Committee report. I think all of you have the report there to review. Be happy to answer any questions. Some of the highlights, though, is for August 2016, we continue to see just more gains as far as patient access that we've created from 2014, 2015, 2016. We continue to increase access fairly dramatically in 2016. Also, a lot of ramping up for influenza season. We already have seen some positive flu cases, and encourage all of you, encourage your constituents to get their flu vaccination. We have a lot of effort in the community to provide those. As you all know, we do have a remodel of our OR waiting room completed, and we'll be ordering some new furniture. That's, if you've ever been there in the mornings, it is a very crowded area with a lot of overflow of patients. We've done that remodel, though, internally with our own facility staff, and they've done a really good job. It's much better than it did before. The emergency department, we continue to see improvement. Had a lift without being seen rate of 5%, and that's with over 6,500 visits for August 2016. We have reallocated some FTEs to allow double physician coverage at times for the emergency department, so I think in September and October you're going to see even more improvement in our flow through there. And also, you can see we have a 97% approval rate for our CHS referrals, and if there's any other questions, I'd be happy to try and answer those.
Counselor Warner?
Thank you. Yes. Brian, what's, I don't know if the legalities regarding Cerner, but could somebody, like, say, a medical transcriptionist, input doctors' notes and stuff like that? I mean, is that illegal? I've talked to several others, and they said that they think that is a possibility. I mean, otherwise, I mean, I see several jobs as far
They
as
dictate into they can dictate notes, and that can be loaded into Cerner.
Put that into Cerner?
Yes.
Okay. Well, I mean, the reason I ask is I talked to, some providers and stuff, and they're on the fence, and, several other clinics, it's kind of been this way. One of the main concerns is they don't have enough time. They're having to take their work home, and I mean, whether that's right or wrong or whatever, they're having to take a substantial amount home to get that stuff input in. And I've looked up the transcriptionist, high school GED with training, 1 to 3 years experience. I mean, you're probably looking at maybe $30,000. And at Redbird, we've got 3 physician spots that haven't been filled. We were close, then it didn't happen. What if you took one of those away and took that money that was set for that, and you got some transcriptionists that came in and helped those? The providers that I've talked to said, hey, I could see more patients if I had somebody to input that stuff. And I mean, if the education amount on a transcriptionist is minimal, then, I mean, it's just something that maybe they could look into. I don't know. And you guys may have already thought of all this, too.
We piloted I think what you're referring to would be a scribe that accompanies a provider into the room, and we have done a pilot with that.
Yep.
I don't think we had ideal planning or setup for that project, and that one did not go well, but we have considered it again.
Okay.
What you see nationwide is with any electronic health record, providers lose a great deal of productivity initially, and then they start to regain some, but it's never
me, and I told them, hey, I'll take that to council. One other thing, pharmacy, and I talked to a provider that patients. So you're talking patients that are, on the level, they're at a 10, on a level of 0 to 10, 10 being really, complex. They get prescribed these medicines, and if we send out a 3-month supply, but week 2, that medicine is not setting well with them, then we have to, they basically trash all that medicine, and we have to start all over. At Redbird, I know that there's been one provider that would like to, I don't know what is our, for samples and stuff, she would, do we do that in other places? Do we have a sufficient amount of samples that we could send somebody home? Hey, here's a trial. Before I give you 3 months worth of this medicine, let's do this for 2 weeks, or let's look at a month and see. That way we're not scrapping out 2 months worth of meds and then starting over, and then, that process could continue. I got a son that seems like he's allergic to everything, you know what I mean? So, on day 2 of this antibiotic, we've got to scrap that. We go back, we went through 3 or 4 to find one, and I know you're looking at money down through there, and it's just something, I didn't know if we do sampling or anything like, I don't know if you can answer that question or not.
We don't typically have samples in the health centers for several different reasons, but we can certainly give people a trial amount of medication to try before they get a 90-day supply sent to them.
Okay, all right, thank you.
Counselor Taylor?
I understand that there is a mumps epidemic in Arkansas, and I'm assuming that you're on top of that and ready
We're
for
monitoring,
that?
yes.
I mean, it just seems
And that,
crazy.
it does, and it just highlights and underscores the need for immunization. And we are seeing in the urgent care, actually, more and more adults coming in to get caught up on vaccinations, so.
Well, I think there was a period where the MMR vaccine was not very effective, maybe in the
Correct.
60s or early 70s, and so if those people have never been checked, they may be affected by it. Okay, I just wanted to be sure that we were ready.
We try to be ready for that, yes.
Okay, thank you. That's all I have.
Any other questions? Counselor Bezer?
Yes, Brian, I got a couple of things here. Excuse me. At the J Clinic, I noticed we still have several vacancies. One vacancy in particular is a patient services advocate. And I know, I'm sure you know what those people do. It's just like Star Lynch does at the Hastings Hospital here in
Yes, sir.
Tahlequah. Those are really needed. That person really needs to be replaced. My wife used to do that, but she retired probably 5 months ago and haven't seen any advertisement on it. So I certainly want to bring that to your attention and to Connie's attention. The other thing is a child doctor. We had one at one time, Dr. Smith. She left probably 2 years ago. Haven't seen any advertisement for a pediatrician there, so we need one of those there also. Mental health worker. That person has been gone probably 3 or 4 months now, but I think there's a lot of need for that. I know I've been told before that it's covered, and I'm sure it is covered, but it's not like having the same person that you go to on a monthly or weekly basis, however you go to. It's covered, you know, from people from different things. So those 3 positions I would like to see us recruit. I know we have a physical therapy room there, which no recruiting on, but there was a recruiting and the person declined the offer. So hopefully that gets back on the book as far as recruiting. The other thing I just want to bring to your attention is I've looked at some of these numbers as far as third-party revenue collections by clinic. And I hate to say this, compare Jay's numbers to, let's say, NOAA. It just doesn't even compare. Jay had like 9,094 visits. NOAA had 5,300 visits. A difference of 3,000, almost 4,000 patients, yet no more. So there's something going on, or we're not billing it, or get those numbers when they come in, and this was kind of shocking.
This out to us, and we actually have our coding folks look, there is something not being caught there.
Well, you know what? One of the person that does the billing told me, I get on the system and it sits there and spins. Spins, just can't get on the system. And maybe that's the cause of it. The best we have up there, and it has the phone systems that we have here, and it's good. We'll see if we can check it out.
Okay.
But anyway, certainly would like to. Okay. The other thing is on dental, 10 hours, going from 10 hours to 8-hour days working.
Okay.
And I know it was supposed to start the 1st of October.
Dr. Jones?
What's your question?
My question is, how is the dental clinic going as far as going from a 10-hour workday to the 8-hour workday? And do you think that we're going to see the same amount of patients?
I think we will. I think the same amount.
So time will tell. I guess just looking at it, my common sense, I don't say I can, but you're the director there, you tell me it is, so I'm going to be watching your numbers to see if it is going to work.
Well, you're going to make your providers more efficient in the time they have staff on Mondays and Fridays that they hadn't had in the past.
You know, just looking at, and you know, I think we're all happy that when you came in, you had a difference in our collections there. I'm still happy with it. I just know that a lot of times some of your people that work the 10 hours to 8 hours, some of them not going to like it. I know they're not going to like it. But if you see our numbers 10 right, I don't have a problem with it. I just like to see people at work, you know, if they're working and happy at 10 hours a day, you know, why change? But you have your reasons, so we'll see what happens. Thank you. Thanks. Thank you.
Thank you. Counselor Warner?
Yes, thank you. One more. I've had in the last month, since we last met, I've had several elders come in and sit down and visit with me. Some of their concerns, a lot of it stems from, they hear all that. I mean, when an elder hears that the providers may be heading out the door and they've just gotten used to them, that's a big concern of theirs. And I know a lot of that's not in our hands. Everybody's got their own agenda. But some of the other things stem to the difficulty that they're having there with the meds and the call-ins and some of the protocols on the procedure of how they can call in and get their meds. Several of them tried to explain it to me, and I left those notes at home. But they have, they're having some difficulties. And if you could just kind of look into them, because they're, the one individual in meds, and he has a brother who lives up in Jay, and he lives down in Flute Springs with his son, so he has that opportunity to come back and forth. But used to, if he'd called in or what, he could swing by and get him at Hastings. Now he's kind of no longer got that opportunity, or it's a little bit more difficult, and that's kind of concerning to him, and he's got some heart issues and stuff right now. So if you could just look into that for me and see.
We absolutely will, and when you get back and you have your notes, if you have a specific
I will.
patient, if you can send that to
I
me,
will.
sometimes that makes us,
Okay,
makes
I
it a
will.
little easier.
I'll send you a name and I'll give you an update.
Because if
on him.
if you got one person having it, you typically got several others, so.
He kind of speaks for a whole of a community there, and he, here's the thing, he speaks from Flute Springs all the way up to Jay in that area, so, and he sees a lot of different individuals in between, so, I'll get with you.
Okay.
Thank you.
Any other questions?
I have Redbird Stent Clinic. We lost a doctor there about a month ago, and we have one that's over diabetes that's just really good with our patients. My thing always is, and everybody has their way of running, management is, before you leave, always give me an opportunity to counteroffer whatever reason is that you're leaving, especially if they're good employees. So I don't know if we do that, but we just can't afford to be losing, docs unless we've got a good bench over there on the sidelines that we can just pull up. And with docs are hard to get. So would you please just check into that?
Yes, sir.
I think the management over there, the clinical director, is okay, but there must be some mid-level management over there that's not performing. So just check that out.
I will, and I will tell you that Dr. Stallcup right now is actually coming back from Fort Smith, meeting with a very qualified Cherokee physician that we're trying to get to come to work in Salisaw.
All right, appreciate you.
Yes, sir.
And one more. I was approached by this person. I don't think he knew what area I was in, but he says, I want to tell you, Cherokee, something that Three Rivers, they were really bragging on the Three Rivers Clinic in the pharmacy department. Said, went through, they treated me with really just royalty and took care of me. I was in and out. So that's
I'll
just
pass
for
that
you.
along. That's good to hear.
Yes. Don Garvin, you're doing a good job.
Work every day.
Yeah, I doubt. Thank you, sir. Thank you, Madam Chair.
Any other questions? All right, thank you.
Thank you.
Okay, old business, none pending, new business, none pending. Any announcements? Looks like the next meeting is tentatively scheduled for Monday, November 14th at 1 o'clock. Motion to adjourn? All in favor? Aye. We're adjourned.
Thank you, and Shelley, could you do the roll call, please?
Yes, sir. Dick Wag.
Here.
Harley Bezzard.
Here.
Bill England.
Aye.
Keith Austin.
Here.
Jack Baker.
Here.
Joe Byrd. Sean Crittenden.
Aye.
Don Garvin.
Aye.
Frankie Hargis. Wanda Hatfield. Rex Jordan.
Here.
Curtis Snell.
Here.
Denise Taylor. David Thornton.
Aye.
Victoria Vesquez. David Walkingstick. Brian Warner.
Honey.
We have a quorum.
Thank you, and Mr. Buzzard, yes, sir.
Mr. Chair, I make a motion that we move item number 7, Indian child welfare, up to the top spot. Ms. Baker has some business that she needs to take care of, and I'll put that in the form of a motion.
All in favor, say aye. Mickey, come on down.
There's not much new, but Angel Tree is in full swing, and so I brought Rachel Four with me, and she has a folder actually for each of you. Rachel, what all does that contain?
Just some information about Angel Tree and the application dates and locations so that you all have them for your constituents.
Oh, Angel Tree.
We do have an online process this year, so that's kind of exciting. Those that have access to online can put the application there. That way they don't have to get out, waste gas or travel. Yes, we worked really, I should say Rachel worked really hard on that. So that's what's awesome about having good employees. You get to take the credit, but you've got, of course, got to give credit where credit's due. So she did that. But we also will have the locations for people who don't have access to the internet or just are a little old-fashioned and want to show up and be there in person, so we have that too.
Okay. Any questions?
I have one.
Yes, sir.
Do we get any funding from state,
From
HHS, or any funding?
the state of Oklahoma, no, I'm going to check for sure with Rachel, but
No, our DHHS funds are federal only. The newest funding we have is on the VOCA side, and it's technically a federal fund that runs through the state.
the District
Is
Attorney's
there
Council.
funding there, they don't let us have it, or?
I don't know the answer to that. We just received the new VOCA grant, and then we've got another DHHS grant that we just received, and that's adding about $800,000 over the year to our money.
Okay.
So typically, Indian child welfare tribes that get state money are 638 tribes, and we're self-governance tribes. So ours comes to the self-governance compact as opposed to the state, is my understanding.
Yeah, okay. I knew we had those funds. I just didn't know if the state had any additional funds that tribes were eligible for that we just weren't allowed to get at this time. Yes.
I got notice that Cherokee Nation got Children's Justice Act, which is a CTAS grant through the Office of Victims of Crime. And that was just funded this year, 2016 CTAS.
Right.
And you all know what CTAS is.
Tell us.
It's the Comprehensive Tribal Assistance Solicitations from the Department of Justice that puts together different Department of Justice departments, does the funding.
That's our 0 to 3 focus, where we're trying to make sure visits occur and that we fix the issues with parents of young children in hopes that they won't be a repeat into the system. So we're really excited about that grant. The other grant that we received is a 4 to 18 focus, where we'll have the contractors with the cultural interests of the kids and trying to build up their self-esteem while they're in our care. So 2 different focuses, 0 to 3 and 4 to 18. Those are the 2 grants we received this year.
Thank you, Mr. Chair.
You're welcome. Anyone else? Thank you, appreciate it. Good luck on Angel. Let's go back and ask for approval of minutes.
Motion to approve. Second.
All in favor, say aye.
Aye.
And now, Marcia. Your turn.
Good afternoon, Council.
Good afternoon.
I just have a couple of things. We were awarded a very small grant, but this is the first grant that has ever been awarded to a tribe. It's from First Nations, and it's going into food distribution so we can do diabetes and nutrition education programs. And it's just $20,000, but we hoping this opens the door for First Nations, for us and others to apply. There was only was Cherokee, Adair, and Delaware County. And the grant specified that where our lowest caseload was for people to pick vegetables and food, and those three areas were our lowest. We can't seem to get them to eat their veggies, and so that's why it was those three areas was targeted. So we'll be starting that real soon. Our Veterans Day celebration, I want to remind you that'll be November 10th.
Question.
Oh, I'm sorry.
Marshall, now what do you have in mind for those people to do what you're trying to get done?
Well, we're in the plant, we just got
Okay.
it, so we're in the planning stage, but I'll keep you abreast of it,
I'd certainly be interested in
all of you. November 10th will be our Veterans Day celebration over at the Vet Center, and it'll be from 9 to 12. That's our annual deal that we do. For our Veterans Resource Fair that was just done, we had close to 200, and we were very pleased, and administration put that one on because we wanted to make sure that all of the veterans had the information needed through the Veterans Administration, so we really partnered with them, and they were very pleased how it turned out, and I'm sure we'll be doing another one over there. I only have one other thing, and Jerry Snell's retiring on October 28th after 43 years serving with the Cherokee Nation. And I want to invite each of you to come on October 26th from 3 to 5. And right now, it's going to be in the Tribal Services Conference area. I don't know if that will change because of some construction going on, but I'll keep you abreast through Gail if you want to attend. That's all I have.
John, go ahead.
Marcia, on the, where they Cherokee First, where they can work, I've had two people that I really told me high school graduation. One of them told me
High school.
uh,
The confusion may be, I'm just guessing, is the one that says college, or have they been taking, the seniors and juniors, I believe now can take college credit while they're still in high school. Are they classified as, could it be that where the confusion is?
well, the hard, good-working, good-looking Cherokee First that said it. That said it included good luck.
They're all wondering if it's them now.
Anyway, that I would just, I'm still kind of confused myself, because one of them had mentioned VOTEC and that they could do VOTEC 1 year.
That might have been done in the past. Remember, that funding was cut, so we may have to be cutting it down. Let me get some clarification for you from
Shoot me an email
from
if you
that
don't care.
good-looking person down there.
Yeah, good bunch of them. Thank you. Thank you.
Early, did you, yeah, go ahead.
Yeah. Marcia, now, I think you're aware of that garden, we have a garden program there at J next to the.
The what, I'm
A
sorry?
gardening program.
Yeah.
Probably can't understand me. But it's right next to the donated food warehouse there. And we have these girls that are in Healthy Nations. They're really good to coordinate some stuff like that, so keep them in mind when you do this for low income in these three counties.
Do you have a name, that one that really works that area?
Well, one of them is Cindy Tudor. Cindy
Cindy
Tudor.
Tudor?
And the other is, this is her name in your wall. Cindy can tell you, just call Cindy.
Okay.
The other thing, the other question I had, and our elderly nutrition sites, do we have any of them that stays open 5 days a week? Are any of them open 5 days a week?
Yes, but I can't tell you which
I
ones
just
they
wondered if
are.
they were. I know the one in Spivey, they've had some problems, and some of the customers say they don't get enough to eat. But I know you've told me before that all of them serve the same. Heard a lot of complaints about that, have you? About them not getting enough to eat.
But I'll check it out.
Check it out and see. And I know these menus are probably coming down from federal, but I went down there and ate one day, and I don't think I got enough to eat, so. Check it out if you would. That's all.
I have to have a comment. Marcia, did you say there were 3 counties that wouldn't eat their vegetables? Because I just had Councilor Thornton throw away his chocolate candy bar here. Is that right?
Say that again. We're going to get a chocolate candy bar, is that what you said?
I said, would you rephrase that?
On the grant that,
Yeah.
okay. It was awarded through First Nations, and we're going to be conducting diabetes and nutrition education in Adair, Cherokee, and Delaware County.
Okay.
All right.
Thank you, Mr. Chair.
You're welcome. Anyone else? Marcia, could you email me the menus for the senior nutrition sites? Are they all the same? Like, I'm asking the same question Harley just asked, I think. They're all the
No,
same.
they have a set menu they have to go by.
If you could, I'd like to see
I'll do
those
that.
about every month. Just send them to all of us so we can look at them,
Okay.
if they can. Thank you. Anyone else? Thank you. Who's speaking for Ron Qualls today? Jumped up quick, too.
I was ready for you. I am standing in for Mr. Qualls this afternoon. He had a family illness that he had to tend to. You should have his, to field any questions. I'm not going to say I'm going to answer them, but I'll take them back to him if I don't know the answer.
And I guess it's not a question, but I see his assistant sitting right there. And probably Gary might want to listen. But these stinking aerator systems that we put in for septic systems. I've had more calls about those systems going in. Now, Chris, and I know I used to do perks years ago when I was up there. Billy's told me the percolation stuff has changed through State Health Department.
Yes.
I remember we did perks, probably thousands of perks in lake houses back when I first started work here. And we never had problems with it because we'd go back and perk a site 3 times sometimes because we'd move the perk holes around. Is that not the case now? Do you just do one set of holes and that's it, or?
Well, we try to look at the site and try to work with the landowner to see where they, if there's any future building considerations or things like that. But, we certainly try to work with the landowner to accommodate where we can. It's just that the DEQ has changed the requirements now, and they're pretty stringent.
Can you send me a copy of those regulations? I'd like to see them. I don't know if the other council members here are having the problems with those aerobic systems, what they're called. They've got, to understand them, you got to almost go to a class. And what it is a problem for our elders. That's who I get called elders all the time, call me, because they either don't understand the maintenance of those things or something, because the aeration systems, the aerobic systems is always a problem. I wonder if Billy ever meets with the state health department to, do we know other people? I'm sure other people have problems too.
We actually have a meeting November 10th in Stillwater with DEQ and some folks with the Oklahoma State Extension Office.
Okay. Well, I certainly would like for you to tell them that we need to do something different. I know we perked thousands of perks for percolations, and I don't know what percentage we had that went bad, but we went back and re-perked them. And I know they say it's supposed to perk when the weather is wet, which is true, you know, I understand that, but still, I get a lot of calls from mostly elders, because they either don't understand how to maintain them or they don't maintain them. I guess that's the case of it is. I'd appreciate it if you guys would bring that up in your meeting with the state health department. And see if there's some other way we can put in septic tank and drain field. Okay. Thanks, sir.
Janice?
I have not received a satisfactory resolution to the bus issue that we've been working on since Thursday.
Yes.
I don't understand the arrangement that we have with Pelican. The driver told the riders that Cherokee Nation would not approve for him to get a CDL. And if that is simply an arrangement that we have with Pelican, are we the ones that would approve that or not? But I've had no response whatsoever on that, and I would like something done about it, and I would like to know what's going on with that.
We'll definitely get you a response. We haven't received a response either. We've inquired with Pelican. But to answer your question on the CDL, we have nothing to do with that.
No.
They are their employees, and if they want to provide a CDL, then that's entirely up to the agency. We don't okay that one way or the other.
Well, that's kind of what I thought.
Yeah.
But why the driver would say Cherokee Nation hasn't approved it, put it off on us, beyond me.
I wouldn't know the answer to that either. But we'll definitely get you an answer on the why they're doing what they're doing.
Okay.
So,
Sounds good.
okay.
Thank you.
All right.
That's all I have.
Councilor Walking Stick?
Did you guys just receive a transportation grant here recently?
We did, and I was
Okay.
going to get into that during my report, but
Okay.
Mr. Chair, if it's your pleasure.
Well, I just have, was there anything, was there a tribal bus or anything inside that grant?
Purchase of 6 vehicles, yes.
Okay, what about like a tribal bus?
No, I don't know what you're referring to by bus, but...
Well, like a lot of tribes have their own. Charter bus? Like a charter bus.
No, sir, no, nothing like that in this grant, no. Actually, vans.
Okay. Sequoia gets used a lot for charter buses and our own bus, or charter bus, for when they go to Cherokee, North Carolina, or the choir, and I think it'd be put to good use.
And the key word there is charter. With the Federal Transit Administration dollars, you cannot use those buses for charter purposes.
Okay.
They've got to be open to the public.
Gotcha.
So
Okay.
if the word charter is kind of a bad word
Gotcha.
as far as those funds go.
All right.
But, we'll certainly keep our eyes open and see if anything comes up as far as any other agencies go. But as
Okay.
far as FTA goes, it's
I
not
understand.
going to happen.
Yeah. And I have one more question for water on the forest residents down at Dry Creek.
Yes, sir.
If you would give me a status on that, they're, I don't know whose table that's waiting on. I don't know if it's Housing Authority, you guys, or if it's the county, but we all need to get together and we need to get an answer for this family.
As counselor, and I will forward you the
Okay,
copy of
thank you.
that.
All right.
John?
Yeah, it has to be for you and what don't, man. I've been sitting here for a year and can I have this? Yes, you may. Can I have that? That's beside the point. But I want to echo what Councilor Buzzer said about the aerobic system. I get a lot of calls on those too. And I know you guys have the guidelines and stuff you got to go by, so it's not a stab at you, but I don't think I've had a good call about those. And also, Mr. Lynn, on the transportation, I think there was one case where we talked and you were doing all you could for me. But does your department, could it handle, some of these calls where an elder needs transported to a certain hospital at Tulsa? at my community that we were trying to set something up with. And I think we were on the right path, but this particular guy passed away. So, but there's different calls that come in. Is that something at all, or does that fall under the charter thing like you were talking?
No, that can be used, these buses can be used for that. As long as it's scheduled far enough in advance and there's a driver and a vehicle available. We are only responsible for up to our jurisdictional boundary. Beyond fare, up to the boundary though, it's going to be, I believe it's $1 or 50 cents each way. So, I mean, it's cheap up to that point, but we can't just, due to the grant limitations, we can't go outside of our boundaries and pay for that mileage. So, but it would be, as long as it's scheduled in time, I mean, and
Two good things,
notice is given, it'd still be a very economical ride for someone.
Thank you.
Mhm.
Thank you.
I've got Buell Anglin, and then I've got Mr. Walkenstick.
Thank you. Thank you, Mr. Chair. Hey, Michael, on the, like Councilor Sean said, will you be able to do that in any district?
Yes.
Jurisdictional
Yes.
boundary? You'll be able to take somebody to the health care, wherever it may be?
Yes.
If they need it?
Yes.
So we're not gonna get that, well, you guys live up there, we don't have anything up that way, you know?
If they're in there, if
Stops at Claremore or whatever.
we cover all of the 14 counties now, so if they're within the jurisdiction, they live or reside within the jurisdiction, and they're wanting to go within the jurisdiction, yeah, there's no question about it. Again, it's based on availability. I can't stress that enough. But if they have everything available and they can get the route or the ride lined out, then by all means, yes. I know there was an issue that County Commissioner up in Washington County called me about here this last week about getting rides to the Oshaleta Clinic. And what we found out in doing that is they were contacting Pelivan, who is operating the route inside the city limits of Bartlesville. It's called City Ride. Well, outside of the city limits of Bartlesville, it's handled by Cimarron Transit, and it was just a little miscommunication there. So I think that individual was trying to contact Pelivan. Pelivan was telling them, no, we don't do that. And they don't go outside this. Outside of that is Cimarron, and we certainly have contracts with Cimarron, and they will provide the services.
Okay, because Cimarron is down in our area, so.
Yes, they are.
Yeah.
That's correct.
Perfect.
Yep. Mm-hmm.
Thank you.
We probably need a meeting with Grand Gateway, with Councilor Anglin and you and myself and them. We're having some of those crossover problems you just mentioned. And one bunch says it's not our doing, and the other bunch, nobody gets transported. And so we either here or up there, I don't care where it's at.
Okay.
At their house or ours. And probably try to, if whoever answers that phone doesn't know the full, complete scope of serving us, and when they say their availability and theirs is two different things. We're paying them.
Sure.
Available to me means like tomorrow you should be available. Maybe not today at 2:30, but tomorrow you should be available. That's not what I'm hearing from them.
Okay.
And I've called the Gateway folks, and they've suggested we meet, and I'm glad that perhaps we could include another counselor who's affected.
Okay. We'll get something set up.
And thank you. Mr. Walkenstick.
Michael, on Welland Road, they, some of our constituents down there, they've had a lot of complaints on the road as far as knocking out their front end alignment and everything else after it's been done. I know Mr. Hall's been working on that project, but they say it's worse than what it was before. Have you been down that road?
Yeah, I was, and I thought it looked pretty good, but that's been 2 or 3 months back. I don't know, so there may have been some things between now and back then.
I was wondering, so you're not aware of the problem then?
No, I have
And the
not.
solution to fix it?
I am not, no. But I'll look into it.
Could you drive down there?
Yes.
Again and give me your opinion on it, what you think? All right.
Thank you.
Thank you, Chair.
You're welcome. Anyone else?
I have one.
Yes, sir.
The road there, Coffee Hollow,
Mhm.
then you go west, what is that little strip called?
I think they call it 790, if I'm not mistaken.
Okay, I saw some construction people out there the other day.
I think they're planning on starting a chip seal on that tomorrow.
You're all right, Michael. Appreciate that. They've already done that. Good work, so.
The reason I know is I just talked to the commissioner today.
Yeah, I've had one lady, she's a diehard.
Yes.
She's been on me for 5 years like that, but
Yeah.
it's happening. All right. Thank you, Mr. Chairman.
Anyone else? Good job, guys. Well, we could just go right into roads.
Oh, I'm sorry, I thought.
That's okay. When questions may have already been asked, but I'll just
He's
give a
already
brief.
sitting there, we've got him.
I'll give a brief report. 10 Killer School Road out near the Welling project that Councilor Walker-Stick was asking about. They got base rock down on about 3/4 of the project. They're clearing and grubbing on the east end of the job. Altogether, in total, it's about 30 to 40% complete. They still have all the paving to go. Lots of work to do out there. So it's still a ways away. Kenwood J, I'm sorry. The asphalt is complete. We're working on a guardrail issue that we're trying to resolve. We've got a problem with some slopes and getting guardrail placed in those areas, but we're working with the contractor to get those problems remedied, and get the guardrail installed and get that job finalized out. The Leach Kenwood Road, I had mentioned last month, the contractor had pulled off of that job to finish some work. I understand they're supposed to be back on site this week to begin building some drainage structures that are needed. Last month, I'd also mentioned on the Northeast Fort Gibson project between Muskogee and Cherokee County, a environmental issue we ran into out there with beetles. We're still working with Cherokee Nation Contracts on getting a contract in place with a mitigation bank where we'll purchase credits, what they call American or ABB mitigation credits, so that will allow us to go ahead and start that project. So we're working through the details on that. Grace Hudlin Road, we here in Cherokee County, we're waiting on appraisals to come back of some property and then once those appraisals come back, we'll begin the right-of-way negotiations with those landowners. Also want to mention Dwight Mission Road in Sequoia County. We met with Commissioner Carter last week and the engineer on that job. Commissioner Carter and his crew is going to be putting in some drainage culverts and stuff along that road to help us out when we come through with our project. So there was in the neighborhood of a dozen or so drainage structures that he was either going to extend or replace altogether in order for us to get the width we needed to overlay it and put 2-foot shoulders out there on that road. So that road, just so we know, it's divided up in two sections. You got I-40 south to the the campground area, whatever. I can't think of this name, slipped my mind. But anyway, I-40 south, and then I-40 north to Pinhook Corner on the north end. The I-40 north is a three-tier project, three-party project. Sequoia County, ODOT, and Cherokee Nation. So it's a separate project altogether. I-40 South is what I'm referring to here, and it'll happen fairly quick as far as the overlay portion. The north portion is a full rebuild, and it's going to take several years to get done, but it is on the books. I did want to touch on what Councilor Walker-Stick brought up. We did receive a grant through the Federal Transit Administration for $321,000. That grant will be used to purchase 6 handicap accessible vans to be used on routes that our providers take care of for us. Right now, we have some buses in our fleet, but the providers are also using some of their own buses out of their fleet to take care of our routes that we have them run. So we'll be replacing some of those buses in their fleets with these new vehicles once they are received. So that'll be a little ways down the road. It takes a while to get those buses manufactured and get them in, but we did receive that money, and I wanted to mention that in here. Last month we had several staff members attend a OSHA 10-hour training here on site. Good refresher course for everybody to it was geared towards road construction and being out on the roadside with traffic and vehicles and things like that. So it was a good reminder and refresher for how to keep them safe during the construction time. And then lastly, I want to mention a gentleman from our roads materials testing lab, Ramon Rollis. He did receive his material sampler certification through the Oklahoma Department of Transportation. He'll be going back here shortly to receive aggregate base certification as well as asphalt certification. So proud of him and proud of that lab and everything that they do for us. So, Mr. Chair, that is my report, and I'll be glad to answer any more questions.
Mr. Garvin.
Michael, on that Fort Gibson Road, who are we waiting on to make this decision?
The decision to purchase the credits has been made. Right now, we're just working out the details to get those credits purchased.
Is it possible to go back and test since it's been a dry year?
No, the testings, we're out of the testing season, unfortunately, so we can't go back and retest. There's only a certain window that you can test in, and we're out of that window.
When will the next window be available?
Oh, boy. I want to say it's around next May, I believe. That's Tom Elkins' group takes care of that, but I believe it's May. May to August, maybe.
When it gets real dry.
Yeah, well, I think July and August are in there, but it's I don't know that dry conditions really have so much to do with it, but I wished it did.
It should.
It should. It might. I don't know. I'm not a beetle expert.
Thank you, Mr. Chairman.
Anyone else? Harley.
Yes. And Michael, you answered one of the questions on Kenwood Road, the guardrail. I noticed those were still out. The other thing is on Chevron signs. I noticed on Kenwood Road, there were some Chevron signs up, and they were on curves that needed those signs, but there were some curves that really need the signs, they don't have them on there. I don't know if you remember back several years ago, we put Chevron signs on one of those sharp curves on Kenwood Road, and somebody ran over them with a four-wheel drive truck. Well, there's none of that there this time. I'm wondering, was that, maybe it was overlooked, we didn't do it.
If they weren't there when we started the project, it probably was an oversight as far as, I mean, we should have replaced what was already out there.
Well, the ones that they put in there, they weren't there before either. There were no Chevron signs there. It's right on almost the same S curve.
Okay.
But my suggestion is that we look at each project and then look at each curve, the percentage of the curve, and that's where a Chevron sign goes. If it meets the degreed curve, then that's where a Chevron sign needs to go. I'm a firm believer, and I think you are, I'm a firm believer in those Chevron signs. And I just think if we had a policy that our designers, instead of if this curve is a certain degrees, and they get Chevron.
Yes.
So, if you don't mind, take a look at it.
We'll look at it, and I'll look at, they may not be done completing with all the signs up there, but I'll find out.
Okay. Okay. And matter of fact, where they have the Chevron sign, it's good, but the one that didn't have needs them worse than the one that had them. So,
okay.
You take a look at it and see. The other question, did you get a chance to look at that striping?
I have not been up there, but we're supposed to be going up there and talking about guardrails, so I intend to look at it then.
That'll work.
Okay.
Thank you, Mr. Chairman.
You're welcome. Thank you, Michael.
Thank you.
Mr. Cooper.
Good afternoon. Let's say a couple of things to report since we met last time. We wrapped up our 9th and hopefully what will be our final negotiated rulemaking for this negotiated rulemaking session. It was 9 meetings over the course of 3.5 years or so that we were able to work through and get something done. Purpose of negotiated rulemaking is for the ones who serve on the committee, and there's 26 of us, 24 tribal reps representing small, medium, and large tribes, and 2 government reps from HUD. And we all sit down and we all discuss and negotiate regulations, and we all reach consensus. That doesn't mean we don't operate on a majority, we don't operate on a supermajority. Everyone at the table has to agree. Now, you don't necessarily have to agree, you just can't express any disagreement. And if you disagree, then our policy is that you have to offer an alternative, and then we go and we negotiate through that. So we were able to get quite a few things done. This negotiated rulemaking has to do specifically with what we commonly refer to as NAHASDA. The technical name is the Indian Housing Block Grant, the formula for that, how the money is dispersed out. We were able to reach consensus, and I will say that every item we agreed to, we all reached consensus on. HUD had originally discussed the possibility of presenting some items for approval that were non-consensus items, and they took those back off of the table to make sure that we were able to reach consensus on every item that was presented. So there were some items that we were able to negotiate that worked out to be good things. One of the things was an item that affected minimally funded tribes, which there is a handful out there. The original minimal funding amount was $50,000, which there's not a lot you can do for $50,000. That increases to about $75,000 roughly, but the money doesn't necessarily, it's not taken away from anyone. The money comes from recaptured money. So after the additional disbursement out, any money left over, then it would go to help fund those tribes first before it's redistributed out. So it's something that really doesn't take any money away from anyone at the beginning. One of the other things that we worked towards was, introduction of a new data source. We had used the decennial census, long form information before. Of course, that has not been, and most of the information that was used before will not be available on any future forms. That information's collected through the American Community Survey, which instead of being taken every 10 years is taken every year, and then data is released like in group of years amount. So what we ended up seeing in some of the data runs that were done is we've seen some that we were able to do was agree on what's called a volatility clause, which means that those decreases would be staggered out and even over the range of time. So if a tribe was to get a 15% cut, they wouldn't get a 15% cut all at once. They would get no more than 10% the first year, and then the second year they would get the remainder of that. So what it does is it makes it more fair, and it makes it better for folks to be able to plan. One of the other things that we were able to do is reach consensus on an item. Someone had over a certain number of years of money that was unspent, then they wouldn't be eligible to receive future monies, or would only be eligible to receive a percentage of those future monies. And then that amount would be redistributed out through an undistributed funds process. It's all really complicated. It all has to do with, regulations that we were able to work through, but we were able to get all this done. We're able to reach consensus on all of these items. They're pretty important issues. And those were the main things that I could think of that we were able to reach consensus on. And then we are in the departmental review phase now, so those regulations will probably go into effect sometime probably sometime after the end of the year is when those would go into effect. Most of them aren't set to take place until next October. Because there was certain things like the unexpended funds that had to, we had agreed before we instituted the unexpended funds that the tribe that was going to mainly be affected by the undistributed funds regulation had time to correct the issue, the unresolved issue. So I think that we were able to, and they had a seat at the table, so everyone was in agreement to that. That is one of the main things that I wanted to bring up. Also, for the folks over in Adair County, I served on a HUD put together, and it was kind of short notice this time. They had done it before, but this was the first time. I think that they'd really done it on this scale. A few weeks ago, they hosted a National Native Youth Summit, and there was 120 kids that participated in this, and it was all from all these kids were from Indian country. And I will say, and you all should be very proud, there was a group from Adair County Boys and Girls Club. 2 of the students were from Marietta, 2 of the students were from Stillwell. So it was a 4-person group. They did an outstanding job. I had the honor to serve on a panel discussion. I felt a little bit out of place because there was a deputy secretary, a young actor who stars in the new movie The Magnificent Seven, a lady from Goldman Sachs who used to be a women's basketball coach, chief counsel for the majority on Senate Committee on Indian Affairs, and then the lady who serves as the national director for the Boys and Girls Club, and then me on this panel. And I was like, okay, I think there's something wrong with this picture. But no, the kids were really great. A lot of them, it was their first time away from home. First time in a big city. It happened to work out that it took place during several other things that was happening. So they was like, we want you to serve on this panel. I'm like, I don't think you do. And they said, no, we do. But after I did, it was an amazing experience for me. I know it was for the kids. And, you know, I'd been there before back whenever I was a youth. During some 4-H projects, so it was a good thing, and they all put together. They had to do what was called a local empowerment project that they was going to take back home and institute, and then each region got together and they selected one group of young kids from their region to present their project after our panel discussion. And there was projects, everything from diabetes prevention to language immersion to, gosh, I don't even remember what else. It was a wide range of activities, and these kids and what they had put together, and they had put a lot of effort into these projects, and they were ready to go home and put them in place. So that was a good thing. Other than that, I think that is probably all that I have to report, unless anyone has some questions.
We dipped into 50 of the rehabs, is that right? 50 applications?
We are in the process of updating 50 families, still have not returned all of their paperwork to us, and we are working with them.
Next 50.
Now, that is hard to say. I wouldn't be able to even, the only reason we were able to do 50 this time is because we had received some additional money through ICDBG, Indian Community Development Block Grant, last year. That came through, and that was specifically for rehab. So there's 40 that's funded through that grant, and then 10 that will be funded through the NAHASDA program right now. And then once, you know, I really couldn't say anything beyond when we could pull some more, because first thing we got to do is get those families to get their information turned into us so we can either approve them or deny them. Go out and look at their home and determine what needs to be done and how much money is going to be spent, so we know how much money we're going to have to obligate, and then we can move on to the next step.
Have you ever thought about, like in the different offices, like, you know, some, I'm sure you have, but these people, and if they didn't have transportation, take them to the Department of Human Services office, then run down to the bank, then run down and get a electric bill or whatever they have to do. I would really be interested. I've got a lot of folks that I've been blessed with a couple cars in my life, but a lot of these folks, maybe they don't even have a vehicle, some of them, but an elder type advocate for your department to just help these people round up the paperwork, like you're saying, that they need. Some of them are able-bodied, and they better get in gear, but some of them are not. And is anybody interested in something like that, or is that?
We do to a certain extent. I mean, we go out and we have folks who will go out and help them.
Yeah, he's here.
we'll help them sit down at the table with them if they need it, fill out the application and fill out the paperwork. If they can't go down to someplace like DHS, they don't need to. If they can't go to someplace like the bank or something like that, there's some releases they can sign that we can send to the bank or we can send to DHS and get back. The only reason we ask them if they're able to go to, for instance, because one, we are required to, is if we send it to them, the end of the month before we get it back.
How that works. And
Yeah, so
all the folks that I've dealt with I've never had one of them say, they told me I didn't even have to do that. All of them, one particular sticks out in my mind, didn't have a car, walked wherever he went. So that would be nice to know if there's some things they don't need.
Yeah,
because that's a big load on them. But I would still love to have someone, just an advocate for that elder, that when they need running around to get, because what's holding this process up, some of it I hear is paperwork.
That's always a big, eliminate as much of the paperwork that we can, but there are.
Is there any money for something like I was talking?
Off the top of my head, I can't think of anything, but I can certainly do some check. You're talking about more along the lines of a family advocate and things along that. We would have to look at something other than like a direct housing program, because whenever we're talking about a direct housing program, it means that we have been able to determine that they're eligible to receive services, and at that point in time is when we can start using money to help them. Some checking. I don't know that I could honestly answer that right now, this second.
That'd sure be interesting. Like you said, this lady we're dealing with on the windows, there's some extenuating circumstances, and you can help them to a point. And but it'd be nice for her to have a little help, kind of doing some things like that. But I appreciate you looking at it.
Yeah. Now, for instance, on that one, for sure, I don't know that there's something that I could do there, because I think wasn't there a lot of information that had to go to someone outside of our area?
Well, I went
members?
I went and got that one, but I'm talking about all of the, going to the county courthouse, county clerk's office, and but in the meantime, whatever paperwork we're waiting on. She called me yesterday. There's spiders coming in the broke windows, and that's not your fault. That's not my fault. Not really her fault. It would be nice to speed the process up if we could.
Yeah, and as soon as we can get that information, we can determine that she's eligible, we can certainly get out there and fix her up.
Thank you.
And Chief and I were just talking, I think Marcia has some family or elder advocates who do a little bit of that kind of, but I don't know if she can send them over to do them for Gary.
Yeah, I don't know. I mean, that was the first thing I was thinking of, and I didn't want to put her on the spot, but I was certainly going to visit with her afterwards. I try not to put anyone on the spot.
Did I make a comment?
Yes, sir.
Counselor, we've looked at some of this, and I know Marcia's probably spread pretty thin, but we do need a advocate out there that takes our elders or that do not have transportation to take care of these forms. You would think, sometimes it gets me when someone calls me and says, Grandma's out of wood. So what did you just say? Grandma's out of wood. Well, where are you? And now, forgive me if they're disabled and they are not able, but sometimes they're not. So we have tried some of these ideas, but doesn't mean we can't coordinate among the departments to see if we can't take care of each other on these requests that you're talking about, because it is needed. Because what it does, when somebody has an application to be filled out, if they're not able, it just backlogs and backlogs, and they're not able. The next thing you know, we're 60 days into it, and we ain't even got a window fixed. So, things like that. So, I don't know. We need to have our different departments come together and see if we can't consolidate some of these projects and say, how can we help each other out here? And you guys probably already do.
We do. I have staff, if and I know several people have had this come up, and I can probably look at just about everyone here, and they've said, hey, this person needs help on this, and I don't think that they can come in. First thing we do, and it's usually within 1 business day, is we get them on the phone and say, hey, can we send someone out to help you fill out the paperwork? And sometimes it's, yeah, sometimes it's, well, I'll come in and do it, or, well, yeah, can you come out tomorrow, or can you come out next week? And we will. We make arrangements to come. Pretty good staff, bilingual staff, that I use. Most of their time may be sitting down and visiting with them, but it's also, doing the paperwork. But especially with our elders, we certainly try to do
Kept
that.
looking at Marcia, I was hoping she was going to bail you out. She just waved me off.
Yeah.
Thank you, Gary. He went on. We do have elder advocates that go out on a need basis, and they fill out the paperwork just as Gary does.
And do a good job at it.
Yes, and the problem is sometimes, not always, but sometimes that elder advocate is the only one in the office. So you have to make a choice. Do you go out when that person needs it, or do you try to schedule it on down? Because then you're going to leave people who need the services in that office. If you're talking about one Adair County or Delaware County, you're talking about you're going to have to spread it out. And if you want someone just to spend their time out in the community, and that's what I'm kind of hearing, then that's going to take funding. You're going to have to look at insurance. If we transport these people, can you do it in a GSA? And will their insurance cover it? There's all kinds of things. So it's easier to go out to their home and fill out the paperwork, So all of these things have been looked at, and I know myself, I've gone to Social Security hearings for people. And because I work with that client so much, I know a little bit more about it, and they may be, the one I'm thinking of, he had a first grade education, so he couldn't communicate real well, so I was his voice, and I'm not bragging on me, but we do it all the time. And we're out there. Just sometimes it might take us a day to get out there to them. Yeah. And I know Gary has offered to go out on his part, but.
Well, I appreciate what you're doing, and I wasn't trying to, because we're not even clear if you can send anybody to do hazard. So I was just wanting to look at insurance that covers something like that. And but yeah, I just appreciate you looking at that, and for no other reason, like you all try to do daily, and we do, it's just for no other reason, kind of make it a little bit easier on some of those folks. So, thank you.
Thank you, Marcia.
Sorry,
No, you're fine. If that was Diane, she'd already ran over us with the bus and back over. No. I'm joking. Diane knows I joke with her a lot.
Harley Buzzard, you have your hand?
Yeah. Yes. I don't know. Some of the council members might remember. I think David Thornton had a guy worked in his area. It was really good. And that was what, 4 or 5 years ago, David, that we had people that actually did that work?
It's been a little longer than that.
And there was one person from each district that actually went out and specifically did that type of work. I don't think we have them anymore. The person that worked up in my area was Juanita Bark, and she still works for us. But we used to have that program set up. But anyway, I just want to let you know it has been done. But I got a question for you, Gary.
Yeah.
Is the homes in West Siloam Springs, when are they going to start being occupied? I have had more calls about that.
Whenever we actually take possession of them. And we have.
So do I need to call C&E or something?
We're in the process of working on that now. I don't know.
What's the holdup?
Now, I can't answer that because I don't know. I know that, that was one that they had to run the first contractor off and bring another contractor in. And I know that either they are close to that. If they're not done, they're close to being done because we're in the process right now of finalizing that project. But I have not been given a date certain, so I can't give you a date certain. Yeah, I know that we're getting close.
When they were releasing to you.
Yeah.
Is the contract or the work done? Has it been over?
Now, that I honestly do not know. Because we take care of the occupying part, not the construction on those specific ones.
I'll get hold of CNA.
Yeah.
Who's the contact that I call CNA, other than Slade?
I can go back and check.
Let me know, and I'll be glad to come.
Well, now, I don't mind calling and checking on them to see if they can give me a date. But I do know that that there are a couple of projects that we are working on the actual physical closing date so we can sign the paperwork and take possession. But I have not gotten a date certain on West Siloam. I do have a date on Roland, but not on West Siloam yet.
If you could email me the date.
Sure.
And it doesn't have to be a drop dead date,
Yeah.
you know.
Okay, and as long as you're good with that, then I don't, I don't have a problem with that. If you're asking me.
You can't tell me we're gonna move in November
Yeah.
the 1st, and if I say November the 1st.
Yeah, because we're dealing with a couple of other folks besides just us.
Let me know.
Sure.
Let me know.
You bet.
Thank you, sir.
Any other questions? Thank you, Gary.
Thank you.
Dan tonight, she was hot.
Good afternoon.
Uh-huh.
You have a copy of my report, and I'm happy to answer any questions that you might have about it. I do just want to bring up, this isn't in the housing report, but the NORA Summit is next week on Tuesday at Northeastern State University. We have about 300 people from Northeastern Oklahoma attending, so if you want to go and you haven't registered yet, you still have time.
Might tell Gail.
I will.
Any questions?
I got a question.
Yes, sir. Go ahead.
Anna, I don't know how to really ask you this, but somebody was telling me that they went to I don't know if it's through your office or not, but got counseling and got their credit rating score up.
Mm-hmm.
Okay, to go in to look at maybe buying a house, and the loan company or the bankers go back and look at that credit score, or look at the credit, I guess, and then they lower them by 30 points. Is that how that works?
They shouldn't lower it by 30 points, but when you have inquiries on your credit report, if you have a lot of inquiries on your credit report, it does. If you're shopping around.
So they can do that
It will
legally?
lower it does lower your credit report if you're shopping around for credit.
Okay. Well, I kind of thought that might happen.
30
I mean, I guess
points
it's
is
up to the
kinda
bank
high,
to do it,
though.
yeah. Okay, well, I just want to find out.
Mm-hmm.
Thank you, sir.
Brian?
Yes, sir, thank you. Anna, income guidelines, where would be a really easy place for me to send some folks? Because I've got several, we're running into roadblocks in other places, and I've been trying to push the iSave
Mhm.
on their part. So where would be a good place for me to send them as far as income guidelines?
Well, the income, I can send you the income guidelines.
Okay.
They're the same as MAP and the same as the Housing
Okay,
Authority.
if you would, just send that to me.
I sure
because
will.
I'm trying to encourage more of them to put, there's some of them just need some rehab and some
Mhm.
other things to do, and I think that, what's the timeline on that? Is it, if I put 1,000 in, it's a 1 to 5, correct?
It is, it's the time frame on it can be as short as 6 months.
6 months, okay,
Mhm.
okay. But, so if I put in 1,000, then we got the match of 5, and then 6 months later, they can be moving on.
Right. There are some things where we want them to go through budgeting and do
Right.
some savings during that 6
Right.
months and save
Okay.
regularly instead of making a lump sum
Okay.
deposit, but yes.
All right, thank you very
Mhm.
much. Thank you.
You're welcome. Anyone else? Okay,
Thank you.
And old business, none pending. New business, Rex, could you read that in for us, please?
Behind tab 1.
Where's that?
It's a resolution authorizing participation and nationwide elder needs assessment.
Put that in form of a motion.
Yes.
Second.
Good job, Rex.
And this,
That's his motion.
yes, okay.
You're good.
Marcia, do you want to say anything about this before we vote on it?
This is something that we do basically every 5 years or so. I think the last one was actually done 6 years ago. We do a needs assessment, and it's based on our funding through for the nutrition sites. They want to know out there what their needs are, and it's just a instrument that we can use for other grants also, and because needs change from time to time, and we just want to make sure that we have that data.
Motion and second. All in favor, say aye.
Aye.
Would anybody like to be added as sponsor?
Everybody. Good job, Marcia.
Does that need to go over tonight, Shelley?
Marcia, does that need to go over tonight, full council? Tonight?
Not necessarily, but
Okay.
be nice.
You want to amend your motion?
Yeah.
Amend the second?
Oh, sure, second.
Let's just vote on it again. All in favor, say aye.
Aye.
Go over tonight. Announcements. Next meeting, Monday, November 14th at 2 o'clock. Motion for adjournment.
Where's our adjourner guy? Second?
All in favor, say aye.
Aye.
You could say.
Councilman Baker, would you mind blessing me?
Okay, yeah, I'll be there.
Father, we want to thank you for this beautiful day that you've given to us, and we thank you for all the blessings you've given to the Cherokee Nation. And we ask your guidance in our meeting today and for this evening. In Christ's name we pray. Amen. Amen.
Jay, can you roll call, please?
Sir. David Wilkinson.
Aye.
Don Garvin. Bill England. Keith Austin. Jack Baker.
Here.
Charlie Buzzard.
Here.
Joe Byrd.
Honey.
Sean Crittenden.
Honey.
Frankie Hargis. Present. Wanda Hatfield. Rex Jordan. Dick Lay.
Here.
Curtis Snell. Janice Taylor. Here. David Thornton.
Honey.
Victoria Vasquez. Honey. Brian Warner.
Honey.
We have a quorum.
Thanks, Shade. I hear a motion to approve the minutes of September 12th, 2016. So moved. Second, discussion. All those in favor signify by saying aye.
Aye.
All those opposed, motion carries. Down to reports, Ms. Diane Kelly from Talking Leaves Job Corps.
You mean career services?
Career Services, sorry.
Thank you. I just want to say happy Halloween. I didn't wear my Halloween face today, even though it may look like it. A couple of weeks ago, we had our GED graduation, and we had double the amount of students who went through the graduation because they've changed some of the testing requirements. And I want to say a shout out to Council Lady Janice Taylor, who was our keynote speaker. She did an outstanding job and had a good turnout. We had it down at the Armory, and it was full. And we anticipate having twice the amount of students next year because of the testing. So we hope that we'll have more people next year. We will be Darrell will be hosting the state tribal reentry groups. They'll be here for the Cherokee Nation from kind of all day. I think we're going to provide lunch for them, talk to them about some issues. I think there's a couple of state questions that they're all concerned about that will be, I think it's 280 and 281 about some of the people that are incarcerated, you know, and looking at the overcrowding in our prisons and trying to look at some of these people that have done just kind of what I call minor things, looking at them for training and trying to work with them in jobs. So we'll actually be supporting that, and I think that that's one of the topics that they'll be talking about. We've been working with CNB, Sean Slayton, and Chuck Garrett on a couple of projects. I told you that last week. Last month. Well, we've been asked to submit some more material on our workforce. We've been working on that. We're submitting it this afternoon. They wanted some additional information on this one project, which would employ about 5,000 people. Then they also asked us for some information about another project, and they wanted this on tribal lands. They wanted it near a tribal organization by an institution of higher learning, and we hit all 5 marks, and that was submitted last Tuesday. And CNB had Ben Elder working with us, so we submitted a really nice package for that. So we're hopeful that maybe one of those projects will come through for us. We've got 3 businesses that have made contact with us about recruiting. I've been on the telephone this afternoon trying to work with them. One of them's 250 jobs, another one is like 100-something jobs, and Department of Commerce has been contacting us about a couple of potential businesses, maybe up and around the Grove area. They're real small projects, but they're businesses that are looking for people. We've got a bunch of job fairs. We're working with Cooper Flint Co. and doing some construction fairs, working with CNB to get these dates firmed up. Been on the phone with Amber Edwards out of Chuck Garrett's office to get it firmed up. We'll have flyers. Some of the locations are to be announced. We'll get that out to you, and we'll have Gail send it out by email. We've also got a health recruitment fair going on at Muskogee this week. I believe it's Thursday, and then we also have a food and beverage management job fair for some positions at the Hard Rock, and then we've also got 2 more job fairs for the casino in Grove, and working with Vivian and Hunter, and then we're working on with that. The Norris Summit is coming up Tuesday, October the 25th at NSU from 8 to 3 o'clock. Chief Baker will be presenting the additional amount of that $500,000 grant that we got through the Department of Labor. We'll be giving them another $250,000 for this next year. They have been charged with putting together our manufacturing, our hospitality, and our health advisory groups and pulling that data together. So the NOR group's been working with us on that. Have a meeting scheduled on EMS with Elizabeth Odell and Jimmy Summerlin the end of this month. Redirecting our direction for the Cowee Cafe. Anna was successful in obtaining another grant, but the focus is on a different type of clientele, so we're shifting some of the gears in our office and appointing other people to work on it. Leadership Oklahoma is coming to the Cherokee Nation November the 18th, working on sponsoring a dinner for them on Friday, November the 18th at Talking Leaves. We have a new culinary instructor, and he, along with our food service director, will be putting that on for the Oklahoma Leadership Group. Manufacturing Month is the month of October, and Chief Baker signed a proclamation declaring it Manufacturing Month in the Cherokee Nation. We've got several events that we're doing throughout the month of October. We're hoping to have an open house at the Pryor office for our partnership with Pryor Schools on the alternative school, and also our testing site. They were putting paneling, siding, or whatever you want to call it, in the testing room so that it would be soundproof. So they're working on that this week, and we hope to have things ready to go. We won't have the state certification for the testing site by the end of the month, but at least we can have a ribbon cutting and open house at the end of the month, so we can count it as one of the manufacturing events that we've done during the month of October. We also participated in the chili cook-off that was held at Rogers State. This is our second year to participate. We thought we were going to win it. At 4 o'clock the day before, they sent out an announcement that you could send them checks. Well, we can't cut a check at 4 o'clock for the next day, and the deadline's at 11 o'clock. But anyway, our chili was the most popular. They had cups up there. Our cup was running over, and then we put a basket back there. Our basket was even running over. So we got the most popular chili at the event. And so they had to give us something. Next year, we're getting a trophy. They've already told us we were, because they know we're going to win it. But anyway, we participated in that, and the benefit of the money goes to the United Way. And we've got the Taro Vendor Fair coming up November the 17th. Anna and them are working on some workshops that day in conjunction with the vendor fair. I would encourage all of y'all to come up, take part in these workshops. She'll be sending out information about the workshops. Some of it will be on the Indian tax credit. Some of it will be on how to do business with the Cherokee Nation. And I think it'd be beneficial for you all to participate so that when you go out to your community meetings, this would be information that you could share with your constituents. And then that evening is our Taro Banquet. And I'll be contacting some of you all about being part of that agenda. So I'll holler at you probably here in the next day or two. That's pretty much all I have. Do you have any questions?
Any questions? I appreciate you getting the council involved with that Taro Banquet as well. It gives everyone an opportunity to play their part. So we're thankful for that.
Well, we're going to try to make it shorter than it has been in the past. Our door prizes are going to be underneath the chairs and all this good stuff. And
Make it
we just got
exciting.
lots of good stuff going on.
Yeah. Well, you're doing a great job, and we commend you. And if you have any questions for us, you just let us know on how we can help you out.
Thank you.
All
Got
right.
good directors and good.
Next, we got the Executive Director's Report, Mr. Ron Etheridge.
Good afternoon. We got a email from Chair Walkenstick a while ago wanting us to explain just a little bit regarding the Every Student Succeeds Act that will take place starting fiscal year 17-18. And this is requiring the LEAs, or the local education agencies, to consult with Indian tribes on issues affecting native students. And any title programs or anything such as this, or where there's a need for information or input from the Cherokee Nation or the respective tribes, depending on what counties they're in, they're to consult. And it's primarily speaking to those, in fact mandating speaking from those that have over 50% Native American, or those that succeed a grant, a Title VI grant that is over $40,000. Now, I do have, thanks to Dr. Sly, I wouldn't have had this information had she not provided it. So a list of schools that exceed the 50%. And it's far greater than what I ever envisioned. There's actually 19, counting Sequoia and Immersion, that exceed. Most of them are within Cherokee County, Adair County, a couple in Delaware County, and a couple in Sequoia County. But anyway, they do. So we will need to consult with those schools. We intend to get information out at some point in time to these schools, because once again, it's either the 50% or the 40% in a Title VI grant. And so we may have schools that are not over the 50% that do have the grant. So we'll get the information out to them sometimes after the first of the year, and then we'll come back and try to hit it again where they're aware of it, and they know that, they need to get with us. Most of them know this anyway, because they get with us on any impact aid. I just got through going to Caney Valley and setting in on a 21st Century Grant meeting that they had up there, because we're a partner with them on this grant. And, we get invited to be a partner all the time, which we need to be. I mean, they know that that's how they get the opportunity. And, of course, when we have those meetings, we let them know the role that we will play, and regarding that. The fact that it's kind of a pretty good distance factor, sometimes they may not be able to come down here to the Heritage Center and do things like that, although they need to do that, and that was emphasized to them. And the part of the grant is allowing them to come and do that when they want to, and free even. That's part of the grant. The grant pays for it. So anyway, that's kind of where we're at on that. Any questions regarding this right here? Once again, I'll have to look and see what the thing's called again, but is there any questions regarding it?
Any questions for the Every Student Succeeds Act?
That affects all of our schools in 14 counties.
Right, that exceed the 50%, or that have that title over $40,000, Title VI.
Now, from my understanding, it used to be called Title VII.
Yeah.
So they're changing it to Title VI this year.
That's anyway, that's the verbiage here.
Okay.
Yeah, in this.
So
it's listed as Title VI.
Good report, Ron.
That's really, do you have anything?
I've got one announcement. Thursday, October 27th, the College and Career Night. We'll open our doors at 5 p.m. and the program will start at 6. It's going to be up at Sequoia, place where they play. We've got not our public schools, but some of our college partners that we fund, and I believe the Army, the Navy, and some of those folks, Border Patrol, have confirmed with us. So we're kind of expanding out a little bit since this is going to be our second event. And then we're looking at the calendar for scheduling spring north. That's all I've got.
Okay.
All right, good report, Ron.
I'm sitting in for Verna, and just before Jennifer gets up, I just have two things. You have her report as well, but there's two things that I do want to emphasize. Some of you attended this last year. She has the 23rd Annual Early Childhood Conference in Tulsa at the Southern Hills Marriott, if you can make that. And then one other thing I just want to emphasize, the last part of what she's got there, training it's going on. I attended a workshop up there last week that HR brought to us on progressive discipline. She had several people attend. We had other people in education. There were other people outside education attended that. Very well done workshop. And a lot learned there. And she continues to have those, whenever the need arises. So anyway, that's questions on her report.
The College and Career Fair you guys had last year, me and Councilman Warner was up there, and it was a big success, big hit. So I think that's a good service to our people.
Thank you.
Okay.
Thank you. Going down to Sequoia High School, Superintendent Leroy Qualls.
Good afternoon, everyone. Nice fall weather. Last Bureau of Indian Education meeting that consisted of all the boarding schools in Oklahoma, with the regional line officer conducting the meeting. Sounds like the reorg is at a point. I don't know if you know about the reorg with the BIE trying to move the office out of Oklahoma. There's been a lawsuit, and it's kind of at a stalemate at this point in time, and I'm hoping the office stays in Oklahoma. So I just thought I would report that to you. Today, it's been quite a day at school. It's been Monday all day. Got off to a running start this morning, but we had our regional accreditation due today, as many other schools do, and I did certify the report that we sent off, so it appears that we're in pretty good shape. We had college and career fair at our place today. Had several schools attending, a lot of colleges, a lot of career people that were there, career techs there, and pretty successful. I think the kids really enjoyed it. I know our 8th graders almost got left out, and I went downstairs at the last minute and asked them if they were coming, and they said, we didn't know about it. Can we go? And I said, you're invited. And I heard 4 or 5 of them get excited about going up to participate in that. And it's good to have a goal in the 8th grade and not wait until the 11th or 12th grade. One thing I did report at the BIE was that very happy and excited about our school and the way it's getting, I feel like more well-rounded now. And the reason I say that, I reported last spring that we won a robotics state championship, and all the team members were sophomores. Well, 2 weeks ago, we won the academic state championship for fast-pitch softball. First one ever for Sequoia. Not a big deal at a lot of places, but it is a big deal for me. And I'd be remiss if I left out powerlifting, although we can't say that that's academic, but those 3 state championships within the last few months have been very incredible for us. Our band, Pride of Sequoia, received an excellent rating at the OSSAA Regional in Skytook on October the 11th. And they've been pretty outstanding everywhere that they've competed. They do a really good job. Our cross country competed at the regional in Henrietta on October 15th. The girls won the regional championship. The boys were runner-up, with both teams qualifying for state. And just some tidbits, this is the 30th straight year that the boys have qualified for state. Girls have qualified 27 of the last 28 years. And the state meet will be in Shawnee on October the 22nd. Girls will run at 2:15 and boys will run at 3 o'clock. Competed for the first time in a one-act play competition in the OSSAA competition on October the 6th. And believe it or not, they qualified for state. And they'll be in a state meet, which will be October the 28th in Duncan. Think about that. That's something we haven't tried before, and we'll get some good kids. I'd be someone's doing, but we have some really good kids. As semifinalists in state tournament, this is ninth straight. The football's in the hunt for the playoffs. I think they're in fourth. We've got 2 home games left. We've got homecoming this Thursday night against Victory Christian. And that's my supplemental report. You have my other report with you, and if you have any questions, I'll be happy to try to answer those for you.
Questions for Superintendent Qualls? Seeing none? You guys keep doing a good job.
Thank you, and to the council, as always, we appreciate you guys' support, and you guys do a lot for all of our people. Thank you.
Thank you. Now to Cherokee Nation Foundation, Ms. Janice Randall.
Good afternoon.
Hello.
It's the beginning of the school year, and so as you can see in our report, we have finished the camps that we did in the summer, and then our next thing is we've been planning all the JA activities, and I've spoke to, I work with the education department and JOM. I've spoke to most of the schools in the 14 counties and offered our services with any of their BizTown or their junior achievement or personal finance in their classes. And I came 3 years ago, and Cherokee Nation Foundation served about 500 students. And last year we served over 5,000 students on the same budget. And so we may not be funding 100% at a certain site, but what we're trying to do is pay for the amount of Cherokee students or Native American students. We pay their part. And so we can help more schools that have not been getting help with some of the programs that are offered at the school, whether they're ACT or whether they're on call the foundation, and we're going to try to help them. We want everybody to know what programs we offer. And November 1st, the first of the year, and the highlighted ones are the schools that are going to BizTown. They've already signed up out of the 14 counties that we're paying for. And so a lot of schools have already taken advantage of it. November 1st, I'm sure everybody in your districts will be asking when our scholarships open. We don't have that many scholarships, but they are listed here. And this is the only thing that the at-large students, because this is not based on income, and it's not based on a few of them are, like especially the new endowments we've got. Some of them are specific to a county or a district. But we didn't have anyone that applied for this Kenneth Comer, and it was brand new last year, and it's a $5,000 scholarship. So, and it's for counseling. No one met the requirements. And so that's really a good scholarship. And we did have 222 people that applied for the scholarship, so we had a great turnout. Right now, we're doing ACT prep in Sequoyah County, and we start next week at Fort Gibson, which schools can come from any of the surrounding counties there. We're getting ready to do Owasso and Pryor. So lots of schools are calling to set that up, and we want to go wherever we're needed. So that's about it.
All right.
Thank you.
Thank you.
All right, down to old business, none pending, November 14th at 3 p.m. Hear a motion to adjourn.
So moved.
Move.
Second.
Second.
Hey, Jan.